Greetings everyone, welcome to Wally's nursing videos. Today we will discuss a few basic concepts to review for medical surgical nursing. Let's get started. Hemodynamics, lactic acid level monitoring. Explanation: lactic acid, a byproduct of anaerobic metabolism, accumulates in conditions of inadequate tissue perfusion. Monitoring lactic acid levels is crucial. A level exceeding 2 indicates potential organ dysfunction, serving as an early indicator to adjust treatment plans promptly. Hypotension, tachycardia, and tachypnea, fever, and altered mental status are expected. Blood culture is done before antibiotics are administered, avoiding IM and SQ in low platelet patients. Explanation: thrombocytopenic patients with low platelet counts, are prone to bleeding. Avoiding intramuscular IM and subcutaneous SQ injections minimize the risk of hematoma formation, ensuring patient safety. Anemia, low red blood cells which results in low hematocrit hemoglobin. Dyspnea as an indicator. Explanation: anemia leads to reduced oxygen carrying capacity and dyspnea. Recognizing dyspnea is essential for early intervention and addressing the underlying cause. Aplastic anemia. Explanation: aplastic anemia, characterized by low white blood cell counts, heightens infection risk. Isolation precautions are imperative to prevent life-threatening complications. These patients should not be in the same room as another patient with an infectious process, such as cellulitis, but may be placed with someone with CHF, stroke, or MI, since those are not infectious. HIV. Viral load and CD4 count. Explanation: monitoring these markers is crucial in HIV management. Viral load represents the amount of HIV in the blood. High viral load indicates active viral replication. A load lower than 50 is undetectable and non-infectious. CD4 count reflects the immune system's status. A count below 200 indicates immunodeficiency, defining the progression to AIDS. Heparin calculation. Explanation: heparin does not dissolve clots, but prevents clot formation. Calculations ensure accurate dosing, reducing thromboembolic risks while minimizing bleeding. IV infusion. Calculation ensures a continuous and controlled rate of administration, preventing thromboembolic events. Bolus dose. Administered over a short duration, usually over 1 minute, to rapidly achieve therapeutic levels. Neutropenia. An absolute neutrophil count, ANC, less than 500 is considered an emergency because it indicates a severe deficiency in neutrophils, a type of white blood cell crucial for the body's immune system. Neutrophils play a key role in defending the body against bacterial and fungal infections. When the ANC drops below 500 cells per microliter of blood, the condition is known as severe neutropenia. Candidiasis, thrush, symptoms. Explanation: candidiasis manifests as thick white patches on the tongue and dry, cracked mucosa. Early recognition guides prompt antifungal therapy. Musculoskeletal, osteoporosis, loss of bone density. Explanation: osteoporosis, linked to familial height loss, emphasizes a genetic predisposition. Recognizing this risk aids in preventive measures. Osteoarthritis. Explanation: osteoarthritis, a non-inflammatory joint disorder, benefits from rest. Understanding this guides appropriate management. Back surgery precautions. Explanation: post-back surgery, precautions like log rolling prevent complications, ensuring surgical site stability. PCA ratio. How much a patient demands versus how much a patient gets. Explanation: patient-controlled analgesia, PCA, demands a delicate balance between dose delivery and actual administration. This ensures pain control while preventing overdose. Gout management. Explanation: timing medication is vital for optimal management. When to take medications. Administer gout medications 1 hour before meals and encourage maintaining an upright position for 1 hour afterward. Fat embolism. Explanation: fat embolism causes chest rash. Recognition is vital for preventing respiratory distress. Pulmonary embolism. Explanation: pulmonary embolism presents with sudden chest pain and O2 saturation drop and does not improve, irrespective of how much oxygen is provided. Early recognition guides immediate intervention. SBAR communication. Explanation: SBAR, subject situation, often identified by an age, background, issue at hand, assessment, your findings, and recommendation, what you think should be done, ensures structured communication in healthcare settings, promoting effective information exchange. Cardiovascular overview. Myocardial infarction. STEMI EKG reflects St. elevation, and STEMI is indicated by ST depression. Priority action. Explanation. In myocardial infarction, prioritizing pain management and initiating heparin prevents further clot formation. Dysrhythmias, VTOUCH, VFib, QSR. Explanation. Prompt defibrillation for pulseless ventricular tachycardia, VTAC, and synchronized defibrillation for ventricular fibrillation, VFIB, are critical. FIB, absence of wave and readings, is irregular. QSR with no P-wave signals. Atrioventricular block, AV block. Left heart failure, think left and lungs. Overview. Left heart failure occurs when the left side of the heart is unable to effectively pump blood to meet the body's needs. This leads to a backup of blood into the lungs, affecting the respiratory system. Symptoms of pulmonary edema. Shortness of breath. The inability of the left heart to pump blood efficiently causes fluid buildup in the lungs, resulting in difficulty breathing, especially during exertion. Coughing. Fluid accumulation in the lungs triggers a persistent, often frothy cough. Wheezing. Constricted airways due to fluid in the lungs may lead to wheezing sounds. Orthopnea. Difficulty breathing while lying down, requiring individuals to prop themselves up with pillows for relief. Paroxysmal nocturnal dyspnea, PND. Sudden breathlessness awakening a person from sleep, indicating fluid accumulation in the lungs overnight. Right heart failure. Think right and rest of the body. Overview. Right heart failure occurs when the right side of the heart is unable to efficiently pump blood returning from the body. This leads to a backup of blood in the systemic circulation, affecting various organs and tissues. Edema to extremities. Peripheral edema. The most common symptom of right heart failure is the accumulation of fluid in the extremities, leading to swelling in the legs, ankles, and sometimes the abdomen. Weight gain. Fluid retention results in an increase in body weight. Enlarged liver and ascites. The backup of blood may cause the liver to enlarge, leading to abdominal discomfort, and, in severe cases, fluid accumulation in the abdominal cavity, ascites. Jugular vein. Distension, engorgement of the jugular veins in the neck due to increased venous pressure. Fatigue and weakness. Insufficient blood flow to vital organs can result in generalized fatigue and weakness. CHF and BNP monitoring. Explanation. Monitoring B-type natriuretic peptide BNP levels aids in CHF assessment. Levels exceeding 100 indicate likely heart failure. Fluid overload and crackles. Explanation. Crackles during auscultation indicate fluid overload, guiding interventions for left or right heart failure. VOMIT acronym. Explanation. VOMIT, vital signs, oxygen monitor, IV transport is a trauma assessment tool ensuring systematic patient care. End-stage renal disease, ESRD. Explanation. Diabetes is a major cause of ESRD. Monitoring hyperkalemia and administering chiexolate, sodium polystyrene sulfonate, or Lokelma. Ensure cardiac monitoring for cardiovascular stability. Note that these medications will often cause diarrhea. Peritoneal dialysis. Explanation. Checking for outflow issues during peritoneal dialysis prevents complications, ensuring effective treatment. Cloudy outflow is an indicator of infection. Fistula for hemodialysis. Explanation. Fistulas facilitate hemodialysis access. Recognizing and caring for fistulas are essential for dialysis success. Transient ischemic attack, TIA. Explanation. TIA requires TPA administration for clot dissolution, preventing stroke. Seizure management. Explanation. Seizure assessment involves airway management, restriction removal, and documentation of patient actions during the seizure. Ativan, given after the seizure, is the medication used to control seizures. Alteplase, Atiplase, calculation. Explanation. Alteplase administration at 0.9 mg/cg over 1 hour with a 10% bolus ensures safe clot dissolution. Gastrointestinal, GI. Crohn's disease. Explanation. Crohn's disease patients may need B12 supplementation due to malabsorption. Awareness guides nutritional interventions. GI bleed management. Explanation. GI bleeding may necessitate blood products and fluids. Timely intervention stabilizes the patient and addresses the cause. Abdominal assessment. Explanation. Comprehensive abdominal assessment involves visual, auditory, and tactile evaluations, aiding in identifying potential issues. Diarrhea and acid-base balance, metabolic acidosis. Diarrhea, with its frequent loose stools, can disrupt the body's acid-base balance, leading to metabolic acidosis. Vomiting and acid-base balance, metabolic alkalosis. Vomiting, the forceful expulsion of stomach contents, can disrupt acid-base balance, leading to metabolic alkalosis. GT tube and residual volume. Gastric tube, GT, and residual volume. When managing patients with a gastric tube, GT, for enteral feeding, monitoring residual volume is crucial to prevent complications. Guideline for residual volume. If the residual volume is more than 150 ml, it is recommended to hold the feeding and contact the healthcare provider. Increased residual volume may indicate issues such as delayed gastric emptying or intolerance to the feeding formula. Pneumothorax management. Explanation. Emergency chest tube insertion releases trapped air, re-expanding the lung in pneumothorax. Endarine overview. Thyroid disorders. Explanation. Hypothyroidism decreases metabolism while hyperthyroidism increases it. Recognizing these metabolic states guides treatment. SLE, systemic lupus erythematosus. Explanation. SLE, an autoimmune disorder, will have a positive ANA, elevated CRP and ESR, sedimentation rates, and white blood cell counts. Monitoring kidney and liver damage failure signs such as elevated BUN and creatinine is crucial. Differences between hyperparathyroidism and hypoparathyroidism. Parathyroid hormone PTH disorders. Hyperparathyroidism. Overview. This condition involves excessive production of parathyroid hormone by the parathyroid glands. Causes. Primary hyperparathyroidism is often caused by a benign tumor on the parathyroid gland. Secondary hyperparathyroidism can result from conditions such as chronic kidney disease. Effects. Elevated PTH levels lead to increased calcium release from bones, potentially causing osteoporosis. High blood calcium levels can also affect the kidneys and digestive system. Hypoparathyroidism. Overview. This condition is characterized by insufficient production of parathyroid hormone. Causes. Hypoparathyroidism can result from damage or removal of the parathyroid glands during surgery, autoimmune disorders, or genetic factors. Effects. Low PTH levels lead to decreased calcium levels in the blood, causing symptoms such as muscle cramps, spasms, and tingling. Severe cases can result in tetany and seizures. SIAD's syndrome of inappropriate antidiuretic hormone. Explanation. SIAD causes fluid retention and hyponatremia. Management focuses on fluid balance. Diabetes insipidus. Explanation. Diabetes insipidus results in low ADH, low specific gravity, and hypertension. Recognizing these signs guides appropriate interventions. Endocrine disorders. Cushing's versus Addison's disease. Explanation. Differentiating these adrenal disorders is essential. Cushing's disease results from excess cortisol. Signs include weight gain, moon face, and muscle wasting. Addison's disease arises from adrenal insufficiency. Symptoms include fatigue, weight loss, and low blood pressure. Calcium and phosphorus relationship. Explanation. Calcium and phosphorus imbalances impact bone health. Understanding their relationship is crucial for managing metabolic disorders. Pancreatitis. Explanation. Pancreatitis involves severe abdominal pain and IV fluids for enzyme and electrolyte imbalances. Early recognition aids effective management. Ostomy and liver-related disorders. Ostomy education. Explanation. Ostomy education empowers patients to manage stomacare and addresses psychological concerns, improving overall quality of life. Liver failure. Explanation. Liver failure manifests with jaundice and coagulation issues. Early recognition allows timely intervention and supportive care. Hepatitis transmission. Hepatitis A, B, C. Explanation. Understanding the transmission of hepatitis is crucial. Hepatitis A, primarily spread through contaminated food and water. Hepatitis B, transmitted through blood, sexual contact, and from mother to child during childbirth. Hepatitis C, mainly transmitted through contact with infected blood, often associated with needle sharing during drug use. Cirrhosis and ammonia increase. Explanation. Cirrhosis increases ammonia levels. Lactulose administration prevents encephalopathy, though diarrhea may result. Blood components and reactions. Components of blood. Explanation. Blood comprises red cells, white cells, platelets, and plasma, each serving specific functions essential for bodily functions. Hemolytic reaction. Explanation: hemolytic reactions require immediate cessation of transfusion, preventing severe complications. Amputation information: osteomyelitis detection in bone marrow aspiration. Concern for the nurse patient after bone marrow transplant: swelling, redness at the site, and red streaks spreading away from the puncture site. Signs of infection, bleeding from the puncture site. Gallbladder-related issues: cholecystitis and cholelithiasis. Explanation: distinguishing between cholecystitis, gallbladder inflammation, and cholelithiasis, gallstones, involves understanding symptoms, risk factors, and potential complications. Post-gallbladder removal shoulder pain. Explanation: shoulder pain post-gallbladder removal results from referred pain due to carbon dioxide, a transient and common post-operative phenomenon. Oncology: the major secondary prevention of cancer is screening. Lymphoma, types and causes. Lymphoma overview. Lymphoma is a type of cancer that originates in the lymphatic system, which is a vital part of the body's immune system. The lymphatic system includes lymph nodes, spleen, thymus, and bone marrow. Lymphomas can be broadly categorized into two main types: Hodgkin lymphoma, HL, and non-Hodgkin lymphoma, NHL. Types of lymphoma. Hodgkin lymphoma, HL. Characterized by the presence of Reed-Sternberg cells, HL typically starts in the lymph nodes and can spread to other parts of the body. It is further classified into different subtypes, such as nodular sclerosis, mixed cellularity, lymphocyte-depleted, and lymphocyte-rich. Non-Hodgkin lymphoma, NHL. This is a more common type of lymphoma and comprises a diverse group of cancers. NHL can originate from various lymphatic cells, leading to different subtypes, including diffuse large B-cell lymphoma, follicular lymphoma, and mantle cell lymphoma. Causes of lymphoma. The exact cause of lymphoma is not fully understood, but several risk factors have been identified. Genetic factors. Individuals with a family history of lymphoma may have an increased risk. Immune system compromises. Conditions that weaken the immune system, such as HIV/AIDS or immunosuppressive medications, can elevate the risk. Infections. Certain viruses, like the Epstein-Barr virus, are associated with an increased risk of developing lymphoma. Chemical exposure. Exposure to certain chemicals, such as pesticides and herbicides, has been linked to lymphoma in some cases. Complications of mastectomy: lymphedema, cellulitis, finger paresthesia. Mastectomy overview. Mastectomy is a surgical procedure involving the removal of one or both breasts, often performed as a treatment for breast cancer. While it is an effective intervention, it can lead to various complications. Complications: lymphedema. This is the swelling of the arm due to the accumulation of lymphatic fluid. It occurs when the lymph nodes are removed or damaged during surgery, disrupting the normal flow of lymph. Proper post-operative care and physical therapy can help manage lymphedema. Cellulitis. Surgical wounds can become infected, causing redness, swelling, and pain in the affected area. Prompt treatment with antibiotics is essential to prevent the infection from spreading. Finger paresthesia. Numbness, tingling, or altered sensation in the fingers may occur due to nerve damage during surgery. This complication can be temporary or permanent, and rehabilitation exercises may aid in recovery. In conclusion, a comprehensive understanding of these medical conditions and nursing considerations is vital for healthcare professionals. These insights contribute to accurate assessments, timely interventions, and improved patient outcomes. If you have specific questions or need further clarification on any topic, feel free to inquire. As always, if you like the content and wish to stay up to date on the newest content, hit the like, subscribe, and notification bell to be alerted of new posts.